Can start off, Shalini. I think we are live.
Okay. Hello viewers, this is Shalini here, the diabetes counselor from Sotus Raheja. So in our today's live, we have Dr. Vaibhav Kasodekar, who specializes in primary complex and revision knee and hip replacement surgeries. He has done MS Orthopaedics, GNB Orthopaedics, along with FCPS and Diploma in Orthopaedics from Seth GS Medical College and KEM Hospital, Mumbai. He has done fellowship in joint replacement surgeries from Singapore, Canada, UK, and Australia, where he has trained in robotic joint replacements. He's a national and international faculty in orthopedic conferences. He has done several thousand surgeries and more than 20 years of experience in orthopedics. Welcome, Dr. Vaibhav Kasodekar, for unveiling the myths and realities in robotic joint replacement.
Thank you, Shalini. It's been a pleasure to be a part of Raheja, and I thank the entire Raheja team for giving me this opportunity. Thank you. I'll be happy to answer all your questions.
So, doctor, when did really the robot's knee replacement surgery started?
Well, Shalini, to give you a background, this robotic knees started in US in around 2008. And that was the time when it was into sort of a research where they wanted to use a lot of robots and see whether they are making any difference. So from 2008 to 2014, probably nothing much turned out and it wasn't really catching eye of the entire world. But in 2014 and 15, the Striker Orthopedics introduced a robo, which is called as a Mako robo. And that sort of triggered off the interest of the entire world towards this robotic surgeries. So I would say it's around 2014 and 15 when US picked up, and probably in a couple of years, that's around 2017 or 18, India started looking towards these kind of robots with the introduction of a robo. So that's precisely how the history goes back.
Thank you, doctor. That's really amazing and truly grateful to know about these. And can we get to know about the types of robotic or robots available for these kind of knee replacement surgeries?
Right. So, as I said, in 2017-18, it was only the Striker which was making robots. So it was, and then after that, then probably all other companies also started making the robots of their own, and came out with their own versions, which are there. So it was introduced by Zimmer, where they called it as Rosa. Then it was introduced by Johnson and Johnson, which they called it as Bellies, and then it was Smith and Nephew, which called it as Tori, and it was Cubis by our Indian company Merrill Max, which was introduced in India. And now these logos are the name; these are the names of the companies and the robotic names that I'm talking about. But if you really want looking at, then there are ones which are based on the CT scans of these patients, and then there are ones which are not based on the CT scans. So you can say that they are image-based robots, and then there are robots which are non-image based. So these are the different kinds of robots that are now available in India.
Thank you, sir. That's really a lot of information we are getting to know. Let's dive in deep. And in India, doctor, when did it started?
Okay. So as I said, so in 2018, the Mako had set up their lab in Delhi, Gurgaon, and then they were getting their sort of FDA approvals and other things into place. And even then in US, it was under research. But yes, in 2018, they introduced a robo, and it was there in very few centers in India, maybe a couple of centers, not more than that. And in 2020, as we all know, the COVID had struck. And in COVID, this phase was where the robots were not introduced. Even the companies were hesitant to introduce these robots. And in probably around 2021, 22 is when all other companies jumped in. And if you have seen in last 3 or 4 years, there is a sudden upsurge in the robots being introduced into the market. But let me be very clear that the earlier robo, the Mako robo, was the one in which we could do other joints also, like hip. Whereas the rest of the robos which are there, we are able to do only the knees as of now.
Okay, okay. That's a lot. But thank you, doctor. And doctor, can we do other joint replacement surgeries with the same robot?
So as I just mentioned, so there's only one robo which then offers right now to do a hip replacement surgery, but then the software has to be there because the software has to be is totally different for different joints and in different companies. So as of now, except for one robotic robo which is available to do a hip replacement also, rest all of them are more towards knees, whether it is a total knee replacement or a unicondylar knee replacement. So these are the only two aspects in which the robots are really helping us to do the robotic assisted knee replacement.
Okay. So, and doctor, can we get to know some of the benefits of the robots in being involved in the robotic replacement surgeries?
Right. So what has happened is, if you really see, so now we are talking evidence based. See, earlier what happens is that there is so much of marketing which is happening about robotic knee replacement that I think every second surgeon wants to do robotic knee replacement and wants to market himself as a robotic knee replacement. Now, when I was trained in 2017 and 18 in Australia for robotic knee replacement, that time even that robot was on an experimental basis and was costing a bomb because at that time 1 million Australian dollars was the cost which the university hospitals had paid on a research basis. So they were still on experimental basis that they were using. And and then when they are introduced now in the market of India, so they also had to get a lot of approvals. And after those approvals which are there, now these robotic robots are available for us to do the robotic knee replacements. Now, if you ask the benefits which are there, the benefits are of evidence based I'm talking about. So, except for early 6 weeks where there probably the chances of recovery are better, apart from that, there is no added advantage whatsoever for a robotic knee replacement. The robotic knee replacements, in fact, had to match up with the conventional knee replacements for them to really be there in the market and be relevant. So people have to understand that robots are here only to help us and assist us. The surgeons are going to be there. So like we always wisely choose a surgeon who's going to operate us. You have to be careful about the marketing gimmicks of how people are marketing robots, as if the robots are doing the surgery and not the surgeons. So people are supposed to know that it's the surgeon who's operating and not the robot. The robot is ultimately just trying to help you. And if you really go back, if you're talking about advantages, so I feel these are more of extended navigation systems. So earlier we used to have computer navigation to do the joint replacements. So we've done plenty of computer navigations, and this is probably just an extended arm for a computer navigation where it would help us in certain situations. So typically these would help in early recovery, but long-term recovery there is no added advantage whatsoever. Except maybe I would say that if you're doing minimally invasive surgeries or other things, then it's not the robo, but it's the minimally invasive surgery which is helping the patient more than anything else, which we can otherwise also do in a conventional medicine.
That was an eye-opening thing, sir. And sir, were there any long-term benefits of robots?
So the literature, which is now for 10 years now, because now the robots are here with us for 10 years. So as I said, 2014 to 2024. So in Jan 24, there are these papers which are released, which says that there is no added long-term advantage as far as robotic knee replacements are concerned. So they are probably matching up with the conventional and does not have any whatsoever added advantage. So if someone asks me, is there any advantage of using long-term advantage of using robo? I would say no, there is no long-term advantage as of now.
Okay, okay, doctor. And sir, there were the claims of robotic surgery. Were they really true?
So the claims are many, So it's like this. It's like marketing, right? So you market any product, you see so many advertisements which are happening on television, on radio, on social media, and everyone is trying to sell their product. So what is happening is there are a lot of false claims which I feel the robotic surgeons are trying to do. One of them being that it causes less bone loss or it causes less blood loss or there is no physiotherapy required, or the incision is smaller. So let me be upfront, these are all false claims. The incision still remains the same. It depends on the surgeon whether he wants to do minimally invasive or a conventional, but robo does not reduce the incision which is there. As far as a blood loss is concerned or a bone loss is concerned, like the bone that we cut, it's the same because the implants have not changed. Implants have remained the same. So whatever bone that we are cutting still remains the same. So there is no question of less bone loss. As far as a blood loss is concerned, we are still opening the joint the same way. The surgeon only is opening up the joint. Surgeon only is closing the joint. So the robo is helping us only with the cuts. So less blood loss again is something which is not correct. Now, some of the surgeons are saying that no physiotherapy is required, but probably lesser physiotherapy is required in unicompartmental knee replacements. Otherwise, not because of robo, but otherwise. But for total knee replacement, saying that physiotherapy is not required is a very bold statement, and I think one should not go for it because all the patients have to do physiotherapy, whether you teach them beforehand or you ask the physiotherapists to help them. They have to undergo physiotherapy. They have to undergo exercise program without which they would not get desired results. So definitely there is no doubt about it. Physiotherapy is required in knee replacement surgeries.
Thank you, sir. That was really like bursting the myths and coming back to realities. And sir, can we get an idea about the cost of this robo or the robotic knee replacements?
So the robos are costing a bomb, I would say. It will vary anywhere between 4 or 5 crores to 10 crores, depending upon the robo, the company, and the type of softwares that you're taking. Because each software costs. So some hospitals may just take for a total knee replacement. Some may add up a unicompartmental knee replacement also. And maybe if you're doing a striker, then you may take a hip software. So all softwares cost. So that's why the cost is variable, anywhere between 4 or 5 crores to 10 crores. Now that is just the cost of the robo which the hospital or the surgeon has to bear. And at the end of the day, any cost which is procured by the hospital or the surgeon will be passed on to the patient. So at the end of the day, patients are paying for the advanced technology that we are using. And typically, if you look at any patient, you are looking at anywhere around 1 to 1.25 lakh of rupees over and above the conventional knee replacement. So if someone comes to me and says that I want to have a robotic knee replacement, the package straight away changes by 1 to 1.25 lakhs because there are certain things which you have to use in robo which are disposable. So if you're using those disposable things, then it is going to cost anywhere around 1 to 1.25 lakhs more than the standard knee replacements. So if the standard knee replacements are costing anywhere around 2.5 to 3 lakh of rupees, then probably this is going to cost you around 4.5 lakh of rupees. So that's roughly the difference that you're looking at.
Thank you, sir. So moving with the pace, and let's come for the little note of complications of this robotic knee replacement surgeries. Were there any?
Right. So if you look at it, when you're marketing, you never say that this is our drawback, right? So any robotic knee replacement surgeries which were done abroad, and I'm talking evidence based. I'm not talking about a particular surgeon or a particular thing. These are all there in the journals and which have been published. So there are two major things which come out when you're doing a robotic knee replacement, which was same earlier in navigation also. So when we have to put in those pins and there are pin trackers which are there which we put. It has been observed that there are chances that you could undergo fractures around the pin holes. So that is one of the complications which can occur in a robotic knee replacement. Also, the chances of muscle injuries are much more in a robotic knee replacement as compared to the conventional. So these two are definitely there where we are talking about the complications which can definitely occur and which have been recorded and been published in the journals.
Thank you, Doctor. Truly amazing to have this conversation with you. So, could you give us any take-home message for our viewers that can be helpful for us?
So if you see any new technology which is there, I always tell my patients, I said if you're going from from your workplace to home, do you put a GPRS or do you put a tracker to go home? I said you know your home where it is and you know the best route that can take you there. So you don't use your GPRS. You use GPRS only when you feel that you're going to an unknown place or you know that this is the area which I'm not aware of, so let the Google guide me where I'm going. Similarly, these navigation or robots are there. In particular cases, they do really good. So typically, when we are talking about very articular fractures which are being fixed with rods and screws, or some kind of deformities which are there in bones, and which is not a standard knee replacement, and we want to have a good alignment at that time. These are the cases in which the robotic knee replacement or the navigations really help us and they really guide us, because then we're going into an unknown area. But when you're going, but 99.9% of the cases when we have our standard total knee replacements which we are doing, we don't need to do it. And a good joint replacement surgeons would be able to get the same alignment which the robotic knee replacements are talking about, to have a better alignment. They are able to get the same alignment in a conventional way for last so many years that the joint replacement is in. So if I'm doing joint replacement for last 20, 25 years, I've been doing it with my average of being plus or minus 3 degrees, which is a acceptable, what I should say, range in which you are supposed to get your knee replacements done. Now, if I'm able to get these things done by conventional, then why would I use a robot? And why would I ask my patients to pay more? But having said that, it is still an evolving technology, and we definitely have to adapt and accept newer technologies which are coming in this world. And there are different cases which definitely help us by using robots. So I am saying that all senior surgeons have to accept newer technologies which is coming in, but at the same time it has to be cost effective to the patient and has to definitely have a benefit to the patient. If there is no benefit to the patient and the patient is just paying more money for it, then for me it does not make any sense. So a new technology always have to have an advantage to the consumer, to the user who is there, then only it makes sense. Otherwise I would just call it as a marketing gimmick.
Thank you, sir. Truly appreciating, and we are really grateful for your valuable time and giving us such really great messages and eye-opening responses. Thank you so much, Doctor.
Thank you so much. Thank you, Shalini, for having me. Thank you.